Welcome to the Duke Spine Institute live surgery broadcast. We are now going to be performing a bilateral, meaning both sides, L3-4, L4-5, L5-S1 facet joint rhizotomy. This will involve the destruction of 4 nerves on the left and 4 nerves on the right. The first one is at L3-4, and that is where we are starting to head towards with our first needle. Shot. Okay, perfect position. I feel bone. Could not be better. That is the exact spot you want to be. We're going to do a little num-num. Come up. Incision. I got it. Thank you. I'm going to make my first incision. This is a 3mm stab incision. It's done with a number 11 blade. Once the incision is made in the skin, the next step is to navigate. What was that? That's not me, right? No. The next step is to navigate down to the facet joint. Shot. Just about there. Again, we're starting, shot, with the left L3 transverse process. Shot. I feel the transverse process. I feel the facet joint. I'm literally right where I need to be. I cannot go more medial. I'm literally up against the facet. The muscle contractions are quite powerful. Shot. So because we're not doing this under general shot, we're doing it under sedation and local. There is no chemical paralysis of the paraspinous muscles, and everybody's different, but in some people they have a very powerful response. Shot. There's not much Dr. Berndes can do either, shot, because the patient's not under neuromuscular blockade. Therefore, we're sort of limited in how much control we can get over the muscle contraction. Right? Berndes? Feels good. That was the left 3. Now we go to the left 4, TP. Shot. Need to be a little more inferior. I'll tell you my thoughts as I'm doing this so you can listen and understand. That's nice. If I can be a little more lateral. Shot. The little wavy lines are what's called a Raytech shot. That's heading right to the TP. I'm on the TP. I can feel it. Hold on. Shot. That's perfect. So it's perfect position. I'll move hold on. Take another shot. See how that's right lateral to the pedicle? Yeah, it's in perfect position. Yep. Go ahead. So once I give a little bit of Novocaine to that area, now I'm going to bring my rhizotomy probe. It's called the Duke plasma probe. This device is going to allow me to deliver the energy I need to deliver right to the area where the patient has their medial branch of the dorsal ramus. Shot. 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 I'm heading down to the TP and the facet. Shot, that feels pretty good there. It could be a little bit more medial. I'm feeling, once again, I'm up against that facet joint. I'm going to do a couple of burns. Shot, these are burns, by the way. They are burns. We're burning an area on the spine where a certain nerve runs, and that nerve is a nerve that only transmits pain. It's just a bad nerve. It's called the medial branch of the dorsal ramus. It allows us to feel pain in our facet joints. But when you have disease of the facet joint, where the facet joint is constantly in pain, you don't want to feel the pain because it's going to really have a profound impact on your quality of life. Again, his muscles are contracting, so it moves my probe. I have to keep repositioning just to make sure I'm in the right spot. This is Dr. Berndez's toughest anesthesia case because the patient doesn't want any narcotic in their body, which is understood. And they want to do this without painkillers. So we're accommodating them, as we always try to do for our patients. Shot. So 3, 4, next is 5. I could tell you this patient has wide facets, meaning their facet joints and their spine is quite lateral, quite wide. Shot. We don't see that in everybody. Shot. But we do see it in some patients. So that looks really good right there. I'm trying to figure out where the TP is. Shot. I don't feel that that's it. There it is. So what I was touching a minute ago is not the TP but the facet, and I knew there was something that wasn't just right, so I moved, and now I'm right at the junction of the transverse process and the superior facet on the left side at L5. I can already see where I'm going to do the next one. Okay. Thank you, Luis. Is that it there?
Right, yes, yeah.
Here, which one?
Right there, yeah.
Well, what's that? That must be where you went in with the needle. Watch out.
Yeah.
It's fine. They're both good spots. So, I've made 2 incisions. This is my second incision. It's 3 millimeters, tiny, and I'm going to treat the L5 shot and the S1, the L5 medial branch of the dorsal ramus, right at the junction, shot at the transverse process and superior facet. Shot. Feels good to me. Again, the muscles are tightening. And I want to, and what I mean by that, folks, is when the muscles tighten, they actually move the tip of the probe. Shot. And by moving the tip of the probe, they move me out of where I want to be into somewhere I don't want to be. So I need to keep checking. Let's just see where this is.
I wonder if some IV Robaxin 20 minutes before we start.
Yeah, it's a great thought.
We should try it.
Absolutely, I think it's worth trying. By the way, I feel a massive amount of arthritis here. Shot. Shot. I'm pretty superficial there. Like, I feel the facet. Shot. I just don't want to go too deep. And I feel like there's tons of arthritis here. I mean, I feel scar tissue, inflammatory tissue, but I feel like I'm getting a really good burn right where I need to be. I'm not letting this probe go any deeper than it should. How's he doing?
Doing well. Good vital signs.
Yeah, I'm right where I need to be. I can literally feel the groove, but there's so much tissue, I want to make sure I get it all. That should be it. Last will be the S1. And, well, they may be calling it something else, but shot. The L5. See right at the tip? That's perfect positioning. We're there. Go ahead.
It's the last level.
Last on the left,
Gotcha. Okay.
and then we'll go to the right. Any questions from our audience?
No current question.
Shot? Shot? That's perfect positioning on the X-ray. And I want to make sure I feel bone underneath the tip, and I do. You don't want to be down around the nerve roots when you do this stuff. Okay? Shot? That's perfect. Absolutely. That's exactly where you want to be. At the on the sacrum. Done. I'm going to switch sides with Luis. And we're going to do the right side and we'll be done. Again, you're watching a procedure called the Duke plasma rhizotomy. It was developed and designed here at Duke Spine Institute. It's performed first at the Duke Spine Institute. And this is going to change the way spine procedures are done in the future. It's already changing it. All right. I think I need to be a little bit more lateral. Can you put pressure, please? Yes. Shot. All right. So I'm aiming for, show us where I'm aiming for. Actually, I feel it right now. Shot. Yeah, that's the perfect spot. I'm exactly where I need to be. Pressure, pressure. And give me the medicine. Okay. Well, somehow it moved. There we go. No shot. Thank you. All right. We've made our first incision on the right, 3 millimeters. He's got very strong fascia, like a trampoline. Shot. I think he'll appreciate being the human trampoline. There we go. And what I had to poke through was his fascia, spelled F-A-S-C-I-A. Shot. Fascia is normal tissues in the body. The fascia is what covers your muscles, covers your certain areas. It's an important tissue. It's made out of connective tissue, like collagen, elastin. All right. That's L3 on the right. Next is L4. Shot. So I need to be inferior. Inferior means to the south. You need to be more inferior. All right, shot. That feels pretty damn good. That's the exact spot we want to be for the, sorry, go ahead. That's where we want to be for the burn of the, the nerve is called the medial branch of the dorsal ramus. I want to say something that this patient may or may not appreciate, but pain, spine pain, requires surgery to cure, period. And there's really a few procedures that are done to eliminate spine pain. I cannot go more medial because I'm hitting the facet. It's right there. That's the perfect position. See, I'm at the top of the transverse process, right where the transverse process meets. That's right where it meets the superior facet. Show us the superior facet. That's it right there. You see that bone that sticks up? This is the most perfect position you could possibly be for this procedure. And it requires a strategic burn using plasma, and that's what we're doing. Now down to L5. I'm already there. Go ahead. This will be our next burn. I'm a little bit lower than I should be, but it's close enough. And go ahead. And we're just about done. We'll be done in 5 minutes. How long did the whole procedure take?
Right now, we're heading into the 19th minute.
So 20 minutes, shot. Too low. Shot. That's better. That's better. Shot. Shot. And you can kind of see the facet right there. I'm on the facet, just on the lateral part of the facet at 5. And again, I feel the same thing on the right side as I did on the left. Huge amount of scar tissue right here. So the nerve that needs to be deadened lives inside that scar tissue, and unfortunately, existing technologies before there was the DPR, which is what you're watching done, the existing technology wouldn't allow treatment of the nerve buried in scar tissue, which is why RFAs fail. Because there's too much scar tissue, not enough power being delivered. But with the DPR, we're delivering maximal power. Yeah, baby. Can you feel it? Can you feel that power? I can. Go ahead. Yeah. We're in. Perfect. This patient has, I hate to say this, but they've made the surgery very nice for me and Luis because I guess they have good anatomy. And I wish all my patients were the same way. So when you have good anatomy, it makes my job easier. Perfect. I'll just show you that. It's perfect positioning shot. Yeah, can't do better than that. I feel the lateral wall of the facet. Shot. Yeah. Yeah, all done. Beautiful procedure. Great job.
Thank you, sir.
Nice job, everyone. Crystal, good to have you back. Dr. Berndes, impressive. Thank you. I want you doing my anesthesia if I ever need it.
That's the highest compliment I can give. Hopefully you never.
Oh, I'll need it for something. You have fluoro time and dose. Any questions from the audience?
No current questions.
All right, no complications. Crystal, might I suggest a pin that works?
There you go.
I got another one. EBL. I'm gonna put it 0.5 mil. No, it's just dry. This was a DPR. You can. I'll be happy to come answer questions, but you know what? If there's no questions, just wrap it up.
Copy that.